This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, July 14th, and I'm Zach Caruso. Our lead story this week is in the Journal of Substance Use and Addiction Treatment and is titled Comparison of Buprenorphine Treatment by Virtual Only versus Traditional Clinicians. Few patients with OUD receive MOUD, such as buprenorphine. Given that many patients, particularly those in rural communities, do not live near a clinician who prescribes MOUD, telemedicine could increase MOUD access. However, clinicians and policymakers are concerned about the quality of the virtual-only model. This study compared the care provided by virtual-only versus traditional clinicians. Authors found few substantive differences in who used virtual-only care. For example, patients initiating buprenorphine with virtual-only versus traditional clinicians were equally likely to live in urban areas. Patients initiating buprenorphine with virtual-only clinicians had more visits in the 6 months after the initiation and were more likely to be on buprenorphine at 6 months, but had fewer days of continuous buprenorphine treatment. These results can inform ongoing debates about the strengths and weaknesses of virtual-only OUD care. Next is an article in the Journal of Substance Use and Addiction Treatment and is titled Methadone Treatment in the Rural and Urban United States, Geographic Barriers and Regional Variations in Medicare-Enrolled Opioid Treatment Program Availability. This is a cross-sectional analysis of Medicare-enrolled opioid treatment programs, or OTPs, in June 2025, as per the Centers for Medicare and Medicaid Services database. For each enrolled OTP, the county was classified as rural or urban based on urban influence codes. Overall, 26% of the counties had a Medicare-enrolled OTP. However, there were significant differences between urban and rural counties. 46% of urban counties had an enrolled OTP, as compared to only 6% of rural counties. Urban areas also had higher per capita availability of OTPs. There were additional regional variations, with the West North Central and West South Central census divisions having the fewest Medicare-enrolled OTPs. Our next article is in JAMA Network Open and is titled Xylazine Fentanyl Positivity and Concentration in Urine Drug Tests. This is a cross-sectional study of 42,000 fentanyl-positive urine drug tests from March 2023 to September 2025. Samples were collected by a specialty pharmacy serving a number of clinical settings, and only samples that were also tested for xylazine were included. Samples were from a majority male population with the most common age range from 26 to 35. Samples from 2 different regions were included, and the relative concentration of xylazine by time and region was calculated. The percentage of xylazine-positive samples was higher in eastern compared to western states. However, both regions experienced a peak in xylazine positivity in summer 2024. Xylazine concentration was consistently higher in eastern states as well. However, both regions experienced a similar decline throughout the study period. The odds of xylazine detection also increased with fentanyl concentration. For every 10-fold increase in fentanyl concentration, the odds of xylazine detection increased 55%. Our next article is in the Substance Use Addiction Journal and is titled Drug Use, Treatment, and Hopes for the Future, a qualitative study of patients on methadone who use cocaine in the age of fentanyl. Co-occurring cocaine use disorder, or CUD, and OUD is not uncommon, and while interventions like contingency management, or CM, and cognitive behavioral therapy, or CBT, are effective for CUD, they may be difficult to implement in methadone treatment programs. To better understand patient perspectives and motivations, researchers conducted a qualitative study alongside a randomized control trial of a digital behavioral intervention. They identified a few themes in this study, including that ongoing cocaine use while on methadone is motivated by emotional distress, persistent cravings, and in response to environmental triggers. Researchers also found that while opioid use decreased after starting treatment, cocaine use may increase. Both external and internal supports facilitate treatment engagement. Next is an article in the Journal of Addiction Medicine and is titled Substance-Specific Mortality Risk Stratification Among Adults with Substance Use Disorders During Acute Respiratory Infection, a 3.4 million patient N3C cohort study. This study examined the effect of SUDs on mortality from COVID infection. Data were obtained from the National COVID Cohort Collaborative, which contained electronic health record data from 85 U.S. healthcare organizations. A total of 3.4 million adults with COVID were included, of which 11% had pre-existing SUD. Having an SUD more than doubled the odds of mortality from COVID. The specific SUDs, their prevalence among COVID patients, and odds of mortality were alcohol 2.5%, opioids 1.4%, cocaine 1.2%, tobacco 8.8%, and cannabis 1.7%. The authors caution that the excess of mortality associated with SUDs is not simply due to the psychological effect of the substance, but also reflects medical comorbidities as well as social determinants of health. Nevertheless, SUDs are a useful marker for increased risk from respiratory infections. Next is an article in Drug and Alcohol Dependence titled A Pilot Randomized Feasibility Clinical Trial of Intranasal versus Intravenous Naloxone in Pediatric Opioid Poisoning. This study of pediatric opioid poisoning compared intranasal or IN and intravenous or IV naloxone administration. The study included 39 children presenting unconscious with respiratory depression and meiosis. They were randomized to receive naloxone either IN or IV. The measured outcome was time from the order for naloxone to the return of respirations. This included the time to obtain the medication, and for the IV group, the time to obtain IV access. The median time for the IV group was 65 seconds, and for the IN group, 24 seconds. The time from the order to administration of naloxone was significantly shorter for the IN group. The authors were surprised that the time from administration to clinical response was similar, 10 seconds for IV and 15 seconds for IN. They speculate that IN naloxone could access the brain via direct olfactory pathways. Next is an article in Substance Use and Addiction Journal titled Mapping the Intervention Landscape for Methamphetamine Use Disorder, a scoping review of integrated pharmacological, behavioral, and neuromodulation approaches. Researchers conducted a scoping review to assess the evidence for various treatments for methamphetamine use disorder, or MUD, including pharmacological, behavioral, and neuromodulation. Naltrexone-bupropion combination therapy had the strongest evidence among pharmacological interventions, while agonist agents such as methylphenidate had mixed findings. Contingency management is the most effective intervention, with longer duration of treatment linked to sustained remission. Mindfulness-based interventions showed reduction in cravings and improved emotional regulation, while oxytocin-augmented therapy potentially improved effects. Finally, repetitive transcranial magnetic stimulation reduced cue-induced cravings. The authors note that no single treatment modality is sufficient and support future research on long-term outcomes. Our final article is in the Journal of the American Academy of Child and Adolescent Psychiatry and is titled Systematic Review and Meta-Analysis, Prevalence, Correlates, and Impact of Cannabis Use and Cannabis Use Disorder in Early Onset Psychosis. This PRISMA-compliant systematic review and meta-analysis sought to quantify the prevalence of cannabis use, or CU, and cannabis use disorders, or CUD, in early onset psychosis, or EOP, and examine their correlates and clinical and functional impact. The authors found that CU and CUD are common in EOP and relate to clinical presentation. Screening and integrated substance use care should be embedded in primary care and clinical settings. Further longitudinal studies and randomized clinical trials to evaluate the efficacy of interventions to reduce CU and CUD are needed. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.